When you're ready.
My research question is, how can the screening process and resources for women with postpartum depression be improved? In this presentation, I will provide a background of information on the effects of postpartum depression, or PPD, how I formed my experiment, the results and conclusions I came to, and their importance in the world. To start, what is postpartum depression? It is, quote, a complex mix of physical, emotional, and behavioral changes that occur after giving birth that are attributed to the chemical, social, and psychological changes associated with having a baby. In short, it is the symptoms of anxiety, hopelessness, and depression 1 week to a year after birth that 1 in 7 women experience. PPD can be separated into 3 categories based on the severity of one's symptoms. From there, different treatments may be used in order to help with symptoms. The first category is called baby blues. This is the least severe version of PPD and is characterized by mood swings, sadness, irritability, and crying. These symptoms usually last a few days to a week and can be treated with lifestyle changes, including increased rest and relaxation, and accepting help from others in order to make time for yourself. Postpartum depression is the next type that has more serious symptoms, including depression, withdrawal from family and friends, difficulty bonding with your baby, and thoughts of suicide. This form can be treated medicinally and with therapy. The third category of PPD with extreme symptoms is postpartum psychosis. This condition is extremely rare and is distinguished by hallucinations, having obsessive thoughts about your baby, and attempting to harm the baby or yourself. It is necessary that these patients receive help immediately, and treatments for this include a variety of medicines comprising of mood stabilizers, antidepressants, and antipsychotic medications. The 2 main concerns with postpartum depression are how the infant and mother are impacted. There have been several studies that have done that look at how the mother experiencing symptoms of PPD can negatively impact the infant. Adaroki Ayantuji and Prakash Chandra's research on this subject has found that, quote, postpartum stress has been shown to have an association with infant growth, nutrition, bonding, temperament, and ultimately childhood mental well-being. If the mother continues displaying symptoms of PPD, it can lead to more serious effects, including impacting growth, feeding, sleep, attachment, and development. This shows that PPD can have long-term effects and potentially impact the baby even after the mother heals and is no longer experiencing symptoms. The other main concern of postpartum depression is how the mother is affected by enduring symptoms. In another article, researchers looked at the impact on the mother's physical health, psychological health, quality of life, relationships, and risky behaviors. It was found that mothers with PPD scored lower on tests of physical health and expressed lower rates of self-esteem, social functioning, and overall mood. They were also more likely to have thoughts of suicidal ideation and other harmful behaviors. I learned about the screening process that women go through regarding PPD through my interview with Chantel Reddy, a nurse practitioner who specializes in women's health and family planning. The standard process is a questionnaire given at a follow-up appointment that asks about symptoms of PPD. When discussing this procedure, Reddy said, quote, how well screenings are done varies because of the stress put on medical providers because of the number of patients they have to see and all they have to get done. They may not always have the time to dedicate to someone who looks like they may be approaching a crisis period, instead thinking about how late that would delay the rest of their schedule. It's hard to say how thorough that ongoing assessment is, as it may vary significantly from place to place. I found this to be incredibly interesting and a little scary because if this screening is not done correctly, women with PPD may not receive the help they desperately need, which could impact themselves and their babies for an extremely long period of time. In addition to this, a research study found that 1 in 8 women said they weren't asked about feeling depressed after their postpartum care. This information about limited resources and problems with proper diagnosis is what made me want to pursue this topic for my research project. I've always been interested in the subject of postpartum depression and women's health because I would never hear much about it, but I assumed it would be pretty common. Through my early research, I learned that it was incredibly common, but oftentimes women were not correctly diagnosed or helped. Learning this, along with my interview with Reddy, I realized that I wanted to understand more and discover how improvements could be made to the overall system. This helped me form my research question when during my interview, Reddy said that she, quote, there was a big gap in proper education and sharing with women and their partners about what are the signs you look out for. You are told the big, scary red flags, but you are not taught about the day-to-day changes that you can't just attribute to fluctuating hormones in the postpartum period. From there, I started to form my experiment. I completed my experiment through a survey of 4 women who had recently given birth. Through this, I asked questions about a few contributing factors that might lead to postpartum depression, as well as seeing if they had experienced symptoms. I then asked about their screening process and the resources they would like to have. I split my series of questions into 4 categories. The first was to learn about their current situation, and I asked, how many months postpartum are you? Is this your first child? And have you had postpartum depression symptoms with previous births? The next series of questions I asked were examples of contributing factors that I found through previous research articles. These questions include, are you married? Would you say that your partner is supportive and helpful during your pregnancy? Are you aware of a family history of postpartum depression? And do you have any mental health conditions? I asked these questions in order to gain more of an understanding as to the symptoms they may present later on. I also asked, does your baby have any health concerns, and have you experienced additional stressful events recently, which may include a new job, buying a house, or the loss of a family member? I asked these questions because if a person has additional stresses in their life on top of giving birth and caring for a newborn child, it is more likely that they might develop symptoms of PPD. The third set of questions that I asked revolved around symptoms of more severe postpartum depression and more common ones. The questions that may indicate more serious PPD include, do you feel anxious when you are not with your baby? Have you noticed extreme mood swings since giving birth? Have you had difficulty bonding with your baby? Have you had trouble sleeping since giving birth that is not related to feeding? And do you feel disconnected from previous friends since giving birth? If a person were to respond yes to any of these questions, it may suggest the person is struggling more than most women after giving birth and could be experiencing PPD. If a person answered yes to these questions, I would make sure to look closely at the resources they received and which ones they wish to have. The questions that relate to more common and less severe symptoms include, have you experienced the baby blues? Do you feel like crying for no reason? Have you felt overwhelmed since giving birth, and do you feel unable to accomplish your daily goals? These questions may not indicate the person has PPD, but might provide insight to their experiences after giving birth. The last series of questions I asked are the ones that are most important to my research question of how the screening process and resources for women with PPD can be improved. These questions include, what was the screening process you received involving postpartum depression? Have you experienced postpartum depression? If you have experienced postpartum depression symptoms, what resources were you supplied with? And what resources would you like to receive in order to get help? These questions are important because they provide me with the most knowledge about how they were assessed for PPD and how they were helped if they were flagged for concern. I also included the last question of resources they would like to receive because that could indicate how they were not helped as much as needed or how the system may be improved. While I believe that my survey provided much valuable information for my topic, there are several limitations of my research. These include a small sample size, similarities between participants, and minimal resources as a high school student. Because my sample size is so small, I fear that my information solely reflects each individual and not a whole group or population. After receiving my responses, I was able to analyze the results. In response to the first category of questions, women ranged from 2 to 10 months postpartum. They also ranged from having 0 previous children to 3. Only one participant experienced postpartum depression symptoms from a previous birth, sharing her experiences with postpartum stress and rage. When asked about the second category of questions, many women had similar results. They were all married and all expressed feeling supported by their partner, whether that varied from very supported or mostly supported and helped. 3 of the women were unsure if they had a family history of PPD, while 1 responded that another woman, not including her mother, had experienced it. When asked about mental health concerns, 1 woman responded that she had experienced anxiety, 1 responded that she had experienced both depression and anxiety, and the remaining 2 had not experienced any mental health concerns. 75% of participants stated that their baby was healthy, while 25% said their baby had a concern with his liver that added extra stress. Half the participants explained that they have dealt with additional stressful life events, including caring for aging parents and losing the child care they had for other children. The next category of questions asked about their symptoms of postpartum depression, these being the more severe ones. Half the women expressed they were anxious when they were not with their baby. The 2 women who experienced this symptom were the same ones who expressed a previous history of anxiety. This shows that there is a correlation that the previous health concerns can worsen one's experience with PPD symptoms. One woman explained that she had extreme mood swings in her postpartum period. No one conveyed they had trouble bonding with their baby or trouble sleeping that was not related to feeding. And one woman felt disconnected with her friends since giving birth. These next questions were related to the more common symptoms of PPD. One person recalled experiencing the baby blues, which can include crying, mild mood swings, and anxiety. None of the participants experienced intense crying for no reason, but half expressed how they had felt overwhelmed since giving birth. In addition to this, half felt that they were unable to accomplish their daily goals because they had too much they wanted to do and not enough time to do it. When asked about the screening process, the women provided information about their questionnaire and survey they were given that asked about whether they were experiencing symptoms of PPD. However, one thing I noticed was that there were inconsistencies in the time frame mentioned with these surveys, ranging from 6 weeks to 6 months. And one woman responded that she was only provided with a handout on information. This shows that there is not a standard system to screen these women and that there needs to be improvements made. 2 women expressed that they had experienced PPD symptoms after previous births, and while one was provided with a new mom class and therapy, one responded, quote, "I received no resources. I wasn't really asking for them or seeking them out though." She shouldn't have to put in intensive effort to find these resources because if she's experiencing symptoms, her doctor should have resources ready and available and be encouraging her to use them for both her and her baby's health. When asked what resources they would like to receive, the women stated that they would like to join a church community, have individual or group therapy, go on medication, or join a new mom group. This again reiterates the point that these women want and need more resources than what they are being provided to them right now. They do not feel satisfied with where they are now and have a desire to work toward a better place. These results, along with the research from other studies that I have looked at, have a large importance in the world today. My results emphasize how common postpartum depression is, as each of my participants developed at least one symptom. They also expressed resources they would like to receive, many including individual or group therapy. All participants who responded to this question expressed how they would like to join a group, whether this be a church community, a new mom group, or group therapy. 2 women who expressed these wants mentioned they are having trouble doing this because it's hard to find the time while caring for a new baby. This shows the incredible amount of time and stress it takes to take care of a newborn and shows the importance of women getting the resources they need. So in response to my research question of how the screening process and resources provided could be improved, I would say that doctors need to take this more seriously, as it has been found to be incredibly common and can have long-lasting effects on both the mother and child. This would mean a change in the culture in order to have a higher stress on women's health and postpartum care. There also needs to be set constants in the screening process so there aren't as many inconsistencies. There needs to be an increase of group and individual resources provided to women in the postpartum period. Their doctors also need to stress the importance that these resources, whether it be a new mom group or therapy, can have and how it can help both themselves and their baby in the long run. The doctors need to work with the new mothers to help them find time to join these groups or access the resources, as some of my participants expressed that this was the reason they were not getting the help they wanted. There needs to be improvements made to the screening process so women are properly diagnosed, and there needs to be more available resources for women suffering from postpartum depression.
All right, thank you. How did your review of the methods used by scholars in the field inform your selection of a method or a process that was aligned with your question?
I looked at the methods of other scholars to help me do my own research by seeing the types of questions they asked. This helped me to structure my survey by looking into both examples of contributing factors and common symptoms. Much of the research I looked at examined multiple aspects of the women's lives, which prompted me to take a more broad look as well.
Okay, thank you. Man, you've answered some of these questions already. Could you expand on the limitations of your method or your data? So the question is, how did limitations of your method or data influence your new understanding? You talked a little bit about that. Could you expand on that?
The limitations of my method included a small sample size, similarities between my participants, and minimal resources as a high school student. Because my sample size is so small, I was cautious that it might mean that my information solely reflected each individual and not the whole group or population. However, because my research aligns with others that I've seen with a larger group size, I believe that my findings are accurate.
Okay. And finally, what's the most important research skill you've developed as a result of the process, and how might you apply it to your future endeavors?
This process has provided me with the knowledge of being able to look at other researchers' methodologies, work to construct my own, and form conclusions based on these results. Because of this, I can bring this with me to college, where I can hopefully be able to work on research again. The most important research skill was learning how to stick with my project and add new elements that were interesting.
Okay, thank you.